Florida is on standby for the first doses of a COVID-19 vaccine. Thank you for staying up with us. I'm Isabel Rosales. 5 Florida hospitals are waiting on the vaccines to arrive 24 hours since the FDA gave the go-ahead. And the number of infections keeps climbing. The state's latest numbers show more than 10,000 new infections and 71 more Floridians dead from the virus. The state dashboard shows a total of more than 57,000 hospitalizations. And take a look right there. We're closing in on 20,000 deaths in Florida alone. Here's the other big number we're constantly tracking. Tonight, the state's positivity rate is just under 8%. Health experts recommend a rate below 5% to slow the spread of COVID-19. We are just days away from the rollout of COVID-19 vaccines, but it will still be months before the majority of the nation is eligible for vaccination. Because of this, drug companies continue to push forward with new COVID-19 treatments to help those who are suffering right now. This is a story you'll see first right here on ABC Action News. Our reporter McKenna King in Tampa tonight with details on a new trial Advent Health Tampa is offering and how their current COVID-19 treatments are keeping patients out of the hospital.
Eli Lilly has chosen Advent Health Tampa as one of the first sites in Florida to begin offering their newest COVID-19 monoclonal antibody trial. Now, this one has not received the FDA emergency use authorization, but it's similar to one that has, which is showing high success rates here in the Bay Area. Last Saturday, Jill Everett became part of this growing statistic.
I was angry. I was angry that I was positive.
She's 68 and living with COPD, part of what puts her in the high-risk group for COVID-19.
I have been extremely careful. No social activities. I go to the grocery store and come home.
But somehow she still caught it.
I had severe joint pain. I had lung pain, short of breath. Low-grade temp.
And luckily, she caught it early enough to receive the Eli Lilly monoclonal antibody treatment, which the FDA granted an emergency use authorization for about a month ago.
It provides almost a temporary immunity to the COVID-19, and that prevents the progression of the symptoms getting more serious.
Advent Health offers the treatment at several locations across the Bay Area under these qualifying conditions: a positive COVID-19 test, mild to moderate symptoms within 2 to 10 days of onset, and comorbid conditions. So far, the average age of patients they've treated is 55 to 60.
They are at risk of developing the very serious advancing to severity of the COVID-19, and many of them would require hospitalization. So this has kept them out of the hospital.
Not a single hospitalization among more than a dozen patients receiving the treatment here in the Bay Area.
I think they probably saved my life.
And for Jill Everett, the symptoms were gone the day after infusion.
It's just gone.
Now Advent Health Tampa is expanding their treatments, adding Eli Lilly's newest trial, another monoclonal antibody treatment, but this one broadening the eligibility for COVID-19 positive patients to those ages 12 and up with mild to moderate symptoms, comorbidities not necessary. To find out whether or not you're eligible for the new Eli Lilly trial or their antibody treatment, head to our website, abcactionnews.com. In Tampa, McKenna King, ABC Action News.